Okay, so today we're here with Dr. Kramer from the Nicholas School of Environment, professor in environmental economics and global health. And maybe he can give us a bit of the policy side and tell us a bit about his research that he's done in East Africa. So I know you studied malaria disease prevention in Tanzania and the different control measures. Could you tell us a little bit more about that?
Sure. So we have done work in Tanzania looking at some community-based interventions for malaria control.
Okay.
One of those is the use of microbial larvicide to kill the mosquito larvae in the breeding sites. And this has been used in some of the urban malaria programs like in Dar es Salaam, but has not been used very much in rural areas just because it's more difficult in rural areas to organize spraying. There are large areas of water, etc. So we've done research on the application of this microbial larvicide in rice paddies and smaller pools of water to control mosquito populations that transmit malaria. So we've done that research for the last 4 or 5 years. And we've also looked at the use of community health workers to go around and use rapid diagnostic testing to find where the malaria cases are and then to distribute the ACT drugs for treating malaria. So one intervention is prevention and the other one is diagnosis and treatment.
Okay, so this is as opposed to a vaccine, you would use this?
Yes, I mean obviously when a vaccine comes along that would be great, but these are things that can be done in addition to bed nets because communities where we're working there's already been universal distribution of bed nets, and so this would be additional practices to reduce malaria further. Okay,
and what is the effectiveness of this?
So we're still analyzing the data. We're not in terms of the preliminary analysis, we're not seeing a big effect of the community health worker intervention.
Interesting.
But with the larviciding, we are seeing some reduction in mosquito populations. Whether or not that will translate into any reductions in malaria, we don't know yet. In part because that's hard to detect because malaria rates have already dropped because of bed net distributions. And so you're dealing with a very small baseline to begin with. So we're still analyzing that data.
Okay. And so is this considered alternative malaria control?
Yeah, I think that would be a way to describe it.
Okay, and I know a lot of human advancement, like creation of infrastructure, dams, or you were talking about rice paddies, agriculture, or even deforestation to put up buildings that often creates malarial breeding grounds. So how do you think we should balance that? Or is there kind of a turn off for that?
So certainly there are environmental influences on malaria. Yeah. Part of those environmental influences are related to human activity. You mentioned activities like building dams, rice paddies sometimes can serve as breeding sites, but also climate change can have an impact on malaria as well, and that's obviously a human-induced factor. So there are those factors, and then also just rainfall, temperature, those are environmental influences as well. So it is important because those create additional challenges for controlling malaria that we keep up all the efforts that have been rolled out in the last decade and a half. Since the year 2000, there's been a huge ramp up in international support for malaria control, particularly with the advent of the Global Fund for Malaria, AIDS, and TB. That has made huge amounts of international funding available.
So would you say that Bill and Melinda Gates?
So the Bill and Melinda Gates Foundation has also put a lot of money into malaria, particularly the development of vaccines. And then the U.S. government has been one of the most effective actors in terms of the President's Malaria Initiative, which was started by George Bush and then continued So these programs have made it possible to greatly ramp up things like bed net distribution, indoor residual spraying of pesticides in houses, and where you have severe outbreaks of malaria. If you go in and do indoor residual spraying, or IRS, that can also make a big difference. The better use of diagnostics, greater availability of malaria treatment drugs, as well as just improving the overall health infrastructure so that countries are better able to deal
And that would also decrease the malaria because they would be creating proper structures rather than
Yes.
failed irrigation systems or
Mhm.
something. Okay.
So the effect of all these interventions has been we've seen an over 50% reduction in the number of deaths from malaria over the last 10 or 12 years. There's still, unfortunately, almost 400,000 people a year dying of malaria, but that's down from about 1 million back in the early 2000s. So all the investment is definitely paying off. The concern at this point is because there's been so much funding that's gone into malaria, and there's been so much success that people may lose their focus and turn to other things. So that's a concern. Can we continue to get the same kind of international funding? And can the countries themselves, where malaria is so prevalent, ramp up their own funding to help with the battle? Because even though there's been great progress, it will probably be more difficult to reduce the remaining number of deaths.
So it's just the last.
Yeah, it gets harder and harder.
Okay.
Just because you're getting into more remote areas, you're getting into areas where malaria is highly prevalent. And then there's also the complication of after you've run these interventions for a while, you begin to see drug resistance. So right now, the ACT, the artemisinin combination therapies are quite effective, but we're beginning to see some resistance in the malaria parasite in places in Southeast Asia. And so we'll probably need another drug that will take the place of that one. We've seen other drugs in the past that have become essentially infeasible to use because of drug resistance. There's also a problem with pesticide resistance, that as you use more and more coverage or application of pesticides, either through the indoor residual spraying or in the insecticide-treated nets, you begin to see the mosquitoes develop some resistance.
And before there was DTD.
Yeah, so then you got to think about using other chemicals for treating malaria. So a lot of challenges still remain.
Okay. And so 90% of the cases of malaria are in sub-Saharan Africa. So why do you think it's so concentrated there? And why is it such a huge problem just there still?
So
it's been almost reduced.
Yeah, part of it is ecological. Africa just has ideal conditions for malaria in terms of rainfall and forested environments and so forth. Part of it is the fact that the health systems are not very strong, and are obviously we're hoping to see those improve in the future. But I think the progress that we've seen in the last decade gives us reason to think that it can be eliminated in more and more countries. I know that there are now some international targets of completely eliminating malaria by 2030. That's a pretty aggressive goal. We'll have to see if that can be met. But I think there is now much more serious discussion of malaria elimination, or sometimes people say malaria
you have
eradication.
a reasonable goal of when?
No, I would not.
Because the last few is hard.
Yeah, but I think the donor community is really setting a goal of about 2030.
Okay. Also, I know you've worked in some countries in East Africa. So, do you see a cultural stigma regarding malaria? I read a few articles about how some people sometimes treat malaria like it's the flu or something. It's just a disease that comes and goes because you can get it multiple times. So do you feel that might be a problem?
I don't think there's a cultural issue there. I think, unfortunately, most of the deaths from malaria occur in children under 5 because when people do not have immunity built up for malaria, it can be a very, very deadly disease. If you survive to 5 or 6, then it is the case that for many people, malaria is not that serious of an illness. That is, you can have malaria multiple times and you certainly are sick from it, but it's not a life-threatening illness. So it is the case that in much of the adult population, people get malaria, but they don't consider it as serious an illness as we might. But I don't think that makes people any less interested in those countries in fighting malaria. They certainly see the devastating impact that it has on children.
Yeah.
It's also particularly a problem for mothers because mothers lose their immunity during pregnancy. So I think there's a lot of commitment and will toward addressing malaria, but it's certainly the case that in some countries people say, well, it is a fact of life, and I'm going to get malaria this year. I can't really, without a vaccine, it's inevitable that some people are going to get malaria every year. So that's just it is part of what people live with.
And do you think the government in some of these countries are geared towards fixing the issue, or is it more the money's all coming from international?
So a lot of money is coming from international donors, but certainly the countries play a very big role. Every country in sub-Saharan Africa has a national malaria control program, and there are many very dedicated, highly trained people working in those programs. We've had a project that was funded by the World Health Organization in which we worked with malaria experts in Tanzania, Kenya, and Uganda. And in every case, we found that there's a tremendous amount of dedication, tremendous amount of expertise. Sometimes they don't have adequate resources, but there is certainly a keen interest in taking more evidence-based approaches. And we've worked with the malaria control programs to develop decision support tools to help them have access to better information so that they can say, well, if we have another $10 million, it would be better to invest that money in bed nets or better diagnostics or more drugs or some other approach. And so there's a lot of interest now in doing evidence-based decision-making in the health ministries in these countries.
And what do you think is the best way?
Well, there's no single intervention that's best. Certainly what has been used the most thoroughly has been bed nets. We've had hundreds of millions of bed nets distributed, and that's made a huge difference. And it's one of the reasons why we've seen rates falling down. Yeah, but you have to augment that with a whole portfolio of interventions, and both preventing malaria and doing a better job of diagnosing and treating people when they have malaria.
Okay. Last question.
Okay.
So what would you say to the general public? Like, what can they do about malaria? How should they spread awareness about it, or how can we do anything sitting here without this problem?
Yeah, well, so there are certainly some important organizations that have sprung up to increase awareness about malaria, to help raise funds for malaria. You may have heard certain celebrities, making pitches for fundraising for malaria. And certainly that can be helpful in terms of, in this country, it's important if you think that malaria is a disease that our government should be doing something about, to communicate to your representatives in Congress to continue to support the President's Malaria Initiative. It is, like I said before, it's been very successful. It's been something that's really made a big difference in a number of countries in sub-Saharan Africa and other parts of the world.
Okay, thank you.